At Dunnes Stores, we're always here for our customers. When shopping, always keep 2 metres apart from others. We encourage shopping with 1 trolley per 1 person. Our dedicated teams are working tirelessly to keep the shelves stocked, so no need to stockpile. Taking care of each other is important, so we have the carers' shopping hours daily from 11 a.m. to 1 p.m. And our amazing staff mean we're always here for our customers. Dunnes Stores.
Make sure the room is nice and warm. Make sure the place is all clean around you and that you have all your equipment available to you before you start to bath. From once you start bathing your baby, from once you start changing your baby, you cannot go to another area of the room to get anything else because babies can roll off at any age, fracture an arm, leg, skull. So it's very important to stay with your baby when you're on a surface like this. You put your cold water in first, you add your hot, you just check it with your elbow. If it's comfortable for your elbow, it's fine for the baby. It's about 36 degrees centigrade, the water temperature. Again, I have all my equipment here. I have the towel, so I have everything ready to go. Babies sometimes will cry quite a bit when they go into the bath initially because they're been in clear line in there very cozy for 9 months. And now they're out and we're changing them and they're also getting used to the new world. So be very, very gentle, take it easy. You put your hand underneath the baby's head like that. You just took the baby under your elbow resting on your hip. Sometimes babies get sticky eyes where their ducts don't function that well initially. So that's why we like to clean them, keep them nice and clean. Now I'm holding the baby in the same position and I'm going to wash the baby's hair. If you're using a solution or buy something that's unperfumed and they don't need too many smelly products, as I said earlier, just wash the baby's hair. Just bring up the water, just wash the baby's hair. Nice and gently. Don't be worried about the head because there are 2 little soft parts in the head called fontanelles. One closed over in 8 months, the other closed over in 18 months. So just wash it nice and gently. This is a very good baby. And I'm going to come back onto my mat and I'm going to lie the baby back down and I'm going to dry the baby's head well. Babies lose a lot of heat from their heads, so make sure that you dry the baby's head very well. Now, when you're lifting the baby into the bath, just turn the baby over on its side, over in this position. Just put one arm, your left arm, underneath the head and hold on to the left arm. And put your right arm underneath the bottom and hold on to the left leg. Now you see there is no way this baby's going to fall on me. I've got the head well supported with my arm here on the left and I've got a good grip of the baby. Nice and gently, you're going to let the baby into the bath. Just, if the baby's enjoying it, of course, just leave them in for a little while. Babies are very used to water from being inside, so they love the sound of the water. I'm going to lift the baby out again. Now you see I'm lifting the baby out nice and gently. Now, see, you settle them down, give them a little cuddle, settle them down, and then you're going to dry the baby off well. Don't forget areas where they can get sore if you leave them wet. All babies are quite fat in here, so get right in there under the chin, because if you leave areas wet, they're going to get red and sore. They're all get right under the armpit here, where they're like that. And another areas get right under the behind the knees and in the groin area. They're areas that can actually get sore if you leave them wet. So you make sure that you dry those areas off very well.
Changing your newborn's nappy is one of those things you'll be doing 7 or 8 times a day, so it's best to be organised from the start. Make sure you have everything you need ready and close to hand. Place your baby on a clean, soft, flat surface. Open the nappy and wipe away excess stools from the genital area with the corner of the nappy. Hold your baby by the ankles and lift up their bottom. Use soft cotton balls or a wet cloth to clean your baby. Clean around the umbilical cord area. For a girl, be sure to wipe from front to back. This will help minimise the spread of an infection. Swap a clean nappy for the dirty one. Use the tabs to see which way goes up. Avoid covering the umbilical cord as this can cause irritation. For a boy, keep his penis pointed down. Fasten the nappy at both sides with the tapes, making sure it's snug, but not so tight that it pinches the skin. Retape the soiled nappy around the contents, put it in a plastic bag and discard it in the bin. Dress your baby and wash your hands thoroughly. Babies wet their nappies several times a day. The number of wet nappies is a helpful sign of how much fluid the baby is taking in. Generally, a baby should have 5 to 6 wet nappies each day. This is a good indication that they're getting enough milk.
I'm going to do the cord when my hands are clean. So I'm just going to take a little bit of water. I've got a little bit of cotton wool here and I'm going to clean the cord, so I'm going right down to the base of the cord. Go right down to the base. Now the cord stump is clamped at delivery to prevent bleeding. That cord stump is going to get darker over the first couple of days. It's going to fall off in about 5 or 6 days. And when the cord stump falls off, the cord clamp falls off with it. You're left with an oozy area that stays oozy for nearly 12 days. And you clean it for nearly 12 days. And in 12 days, they look like you and I and you forget about them. If it ever gets inflamed, foul smelling, bleeding, always take your baby to a doctor or a clinic.
Congratulations if you've decided to breastfeed. This is the best start in life you can give your baby. Breast milk is unrivaled as the ideal food. Not only has it the perfect mix of nutrients, but also all of the infection-fighting antibodies your baby needs. However, like anything, breastfeeding is a skill that needs to be learnt, but once it's established, it will give you great pleasure.
Breastfeeding is the very best start you can give your baby in life. It is a very special, unique formula, tailor-made for babies. It actually protects your baby against all known infections, particularly ear infections and chest infections, and also protects your baby against viruses. We now know that breast milk also helps develop your baby's nervous system. For you, breastfeeding is really good. It helps you build up a unique bond with your baby, because when you breastfeed, you release lots of lovely hormones that help and aid this bonding. It also helps you get your figure back, because you burn up 500 calories more per day when you breastfeed. And it has a great protection against ovarian cancer, breast cancer and osteoporosis.
While you're still pregnant and in the early days after the birth, your breasts begin to produce a substance called colostrum. This is extremely easy for your baby to digest, making it the perfect first food. The first hours after delivery is the ideal time to get started on your breastfeeding.
Breastfeeding on demand is recommended with breastfeeding. That doesn't mean leaving the baby asleep all day, particularly in the early days and weeks of breastfeeding. Babies should be woken up every 3 to 4 hours if they're not demanding feeding. However, breastfed babies can often feed much more frequently than that.
How your baby is attached to the breast is key to the success of breastfeeding. This is called latching on. When your baby is in position, wait until their mouth is open wide. You can tease it open by gently pressing the upper lip with your nipple. Bring your baby to your breast, the chin and lower lip first. Baby's mouth should cover all your nipple and about 1 inch of the brown circle, the areola, around your nipple. Your nipple should touch the roof of the baby's mouth with his tongue underneath. Once your baby has a good latch on, there'll be a period of quick suckling to get the milk flowing, and then rhythmic suckling. When your baby is properly attached to your breast, you'll notice that his mouth is wide open with a big mouthful of breast, and his top and bottom lip are curled out, like the letter K. His cheeks are full and rounded, and his chin is pressed into your breast. The suckling pattern changes from short sucks at the beginning to long, deep sucks with pauses.
There are many different ways to position and attach your baby, but there's some key principles. So I'm going to talk you through a number of different holds. The first thing I would say to mums is get yourself comfortable.
Finding a position that suits you and your baby is important for successful breastfeeding. Make sure you're comfortable and well supported. Use pillows or cushions if necessary. And whether you're sitting up or lying down, keep a drink close by, and most of all, relax.
There's some new research out on a new position for breastfeeding called biological nurturing, and this actually works very well in attaching a baby on a breast. In this position, the mother is not sitting up bolt right upright or lying down. She's semi-inclined and she's lying the baby on top of her body. And in this position, the baby actually self-attaches. This hold now, if you put the baby in what's called the crook of your arm, lying along your forearm, and position the baby with its tummy to mummy's tummy, we call it tummy to tummy, with the baby in a straight line, and if you tuck the baby's bum under your other breast, it makes for very good alignment. Then we encourage mothers in the early days of breastfeeding to support their breast with feeding. You can do this by going in onto the breast with a C hold. Now, mothers often instinctively go in with a V hold, but that'll actually make your nipple very sore. So if you support the breast in a C hold with the under finger well away from the areola, that will actually make a very good shape of the breast for your baby. It's tummy to tummy, it's nose opposite nipple, and it's a C hold on the breast, and when the baby opens its mouth, you bring the baby swiftly onto the breast. So we say bring the baby to the breast and not the breast to the baby. This will actually make for very good attachment. Another variation of this hold is actually something called the cross cradle hold, and a lot of new mums like to initiate this with breastfeeding because they feel they have a lot of control in the actual initiation of the latch. In this, it's similar to the first hold, except you're doing the C hold with your other hand, and you're holding the baby's back and neck with the baby in straight alignment again. So it's very important that you hold the baby's back and neck, and again you're supporting the breast in a C shape, and you're bringing the baby to the breast, waiting for the baby to make a large open mouth, and when it makes a large open mouth, you're swiftly bringing it onto the breast, and then you can put your arm around the baby like this and relax into a nice comfortable breastfeed. There's another hold you can use for breastfeeding called the rugby hold or the football hold. So in this hold, you support the baby's back and neck, let the baby lie along your arm and tuck the baby underneath your breast. And in this position, use the same principles of nose opposite nipple and bring the baby to the breast with a wide open mouth. This is a very good position to use for babies, particularly twins. Another way of breastfeeding your baby is lying on your side with your baby tucked up beside you. A lot of mums breastfeed lying down in bed, particularly late during the night. With this, the mother lies on the bed with two pillows, usually her head on the pillow and her shoulders on the bed, and tucks her baby up beside her, nose opposite nipple. Again, it would be the same principles of bringing the baby swiftly onto the breast when the baby makes a wide open mouth. This is a really comfortable way to feed a baby. There are lots of good indicators that breastfeeding is going very well by looking at your baby's output. In the first couple of days, the babies have very little wet nappies, and ideally one wet nappy. Day 1, 2, day 2, 3, day 3, and when your milk comes in on day 5, the baby will normally have about 6 wet nappies in 24 hours. This is a really good indication the baby is breastfeeding well. Another very good indication is actually looking at the stools. And babies have meconium stools for the first day or two, and they have a changing stool which is usually black, green or brown, day 2, day 3, day 4. And when your milk comes in, a baby who's breastfeeding really well will have 3 to 4 yellow seedy stools in 24 hours. If your baby has these sort of stools, the baby is breastfeeding very well.
Your breastfeeding is going well when your baby is alert and waking for feeds, has a minimum of 5 or 6 wet nappies and 2 soiled nappies per day after the first week, has gained weight, sleeps and settles during the day, and is feeding comfortably and pain-free.
If a baby is not correctly latched on your breast, you won't see rounded cheeks, you'll see dimpled cheeks. You'll also see the baby doing very short little sucklings as opposed to long rhythmic sucklings, or you may see a lot of the areola. In that case, you also may feel a lot of discomfort feeding. So if that happens, it's very important to break the latch and start again. And the best way to do that is actually put your finger into the baby's mouth and let the baby actually suck on your finger and break the latch very gently. Signs that breastfeeding may not be going as well for you is if the baby is not wetting and dirtying its nappies. So particularly in the early days, if you look for urates in the nappy, which is pink staining, and if the baby is not passing sufficient wet and dirty nappies, it would be very good to contact a health professional to help you with your breastfeeding.
Infant formula can provide the correct nutrients for your baby, but cannot provide the protection against illness. As it can take some time before a newborn's immune system develops, all equipment must be washed well and sterilised before feeding.
It's very important to keep all equipment used for baby feeding thoroughly clean. It doesn't matter whether it's breast or bottle feeding, we're talking bottles, teats, breast pumps. They need to be washed thoroughly and then sterilised. This is to prevent babies getting infections.
There will be clear and detailed instructions on the packaging of the formula you use. Make sure you follow them precisely. To prepare a bottle feed, boil fresh tap water in a kettle. When it's boiled, leave it to cool in the kettle for 30 minutes, but no longer. Clean the work surface well and wash and dry your hands. Remove the lid from the steriliser and take out the bottle, the teat and the cap using tongs. Carefully pour the required amount of boiled water into the bottle. Using the clean scoop provided, add the exact amount of formula to the boiled water. Remember, adding too much or too little formula could make your baby sick. Reseal the packaging to protect it from germs and moisture. Screw the bottle lid tightly and shake well to mix the contents. To check the feed is not too hot, shake the bottle and place a drop of liquid on the inside of your wrist. It should feel lukewarm, not hot. To cool the feed down quickly, hold the bottle under cold running water or place it in a large bowl of cold water, making sure the water doesn't reach above the neck of the bottle. Your newborn will probably take between 2 and 4 ounces per feed during the first few weeks and will probably be hungry every 2 to 4 hours. This is only a guideline, and it's recommended to feed your baby whenever and as often as they look for food. Do not try and make your baby finish a bottle if they don't want to, and never reuse leftover milk once your baby finishes feeding.
There are hunger cues to look out for. Babies will stick out their tongue, they may pout their lips, they may put their hand in their mouths, they may eventually start crying, but don't let your baby cry too much before a feed because they can take in quite a lot of air, which can cause discomfort for them later on.
When feeding your baby, you should be in a comfortable chair and position. Lean your baby back at a slight incline while supporting the back of the head and neck. Your baby's head should be higher than the rest of their body. When you're feeding, hold the bottle with the end tilted up enough so the milk completely fills the nipple. This stops your baby swallowing air. As the bottle empties, you may find you need to hold it almost upright. When babies feed, especially from a bottle, they take in air. They can also take in air if they cry before feeding. If the air isn't brought up, it can get trapped and cause discomfort later on. There are some common positions for winding, but use whatever suits you and your baby best. Try holding your baby, leaning against your shoulder and rubbing or patting their back. It's a good idea to put a towel or a cloth over your shoulder in case more than wind comes up. Another position is sitting your baby upright on your lap, supporting him under his chin and rubbing his back. Or lying your baby face down across your lap and gently rubbing or patting their back can also be a good way of bringing up wind.
When you take your baby home initially, babies don't know the difference between day and night, so they really will sleep and eat and sleep and eat. Newborn babies can sleep for almost 16 to 18 hours a day, so it takes a little while for them to get into their routine. Their tummy's small, so they need to feed frequently. It is important to get the right environment from the word go and to get routines in place, and it's terribly important to keep your baby in the bedroom with you, asleep in their own cot for the first 6 months of their lives. It's important to get the temperature of the room right for your baby. The temperature that's recommended is 16 to 20 degrees centigrade. Make sure your baby's not lying near, a cot's not near a radiator, a window where the sun's shining in. Just that they're comfortable but not overheated. And sometimes if the weather's colder, you may need extra blankets. If it's warmer, you can take a blanket off. The message really is, if it's comfortable for you, it's comfortable for your baby. If it's too hot or too cold for you, it's similar for your baby. It takes a little while for babies to get into a nice routine. This will come eventually, but initially you have to try and establish a nice routine. Feed your baby regularly during the day. Don't let babies go for longer than 4 hours during the day without a feed, particularly breastfeeding babies. Bottle-fed babies generally feed 3 to 4 hourly. Then during the night, when you're putting baby to bed, try and have a nice calm environment. It would be very nice if you could bath your baby before you last feed, because babies can sleep very well after a bath. Settle them down, nice calm voice, a little bit of baby massage if you can. And in the night time, when babies wake up in the night, keep everything dark and dull. No bright lights, no chat to the baby whatsoever. Just feed them, change them and put them down quickly. And soon baby will know the difference between day and night. But that can take a couple of weeks. It's very important that the baby is lying on a good firm mattress, back to sleep, feet to foot. Make sure there's no duvets, bumpers, pillows, nothing that can obstruct the baby's airway. A blanket should be at shoulder level, tucked well onto the mattress. And the blankets that we recommend are cotton cellular blankets. They're the only blankets that are really recommended for the first year of life. It's very important to sleep your baby safely, and the message is back to sleep, feet to foot position. And the reason for this is that the baby can't go down onto the blankets. The only way they can go is up. So it's terribly important to have them feet to foot, back to sleep. And this is also a reason why we don't suggest you sleep with your baby in your bed, because babies can roll under heavy warm duvet and can smother.
The first cries of a baby are music to the new parent's ears, and in their early days, crying will be your baby's way of telling you what they need. It will take a little while for you to get used to your baby's cries, but soon you'll learn how to understand them so you can provide comfort.
It's perfectly normal for the newborn baby to cry. From when the baby is born initially, the baby takes that one life-starting breath, that lovely luscious cry comes out when the baby exhales. And babies cry for any number of reasons. Initially, it's not because there's anything wrong, it's just how baby communicates. The reason why your baby can cry is if the baby is hungry, although generally that's a late feeding cue. If your baby has a soiled nappy, if your baby is windy. If your baby gets upwind, they'll probably be hungry again because the wind has taken up the space of food. Once they've burped, they might want more food. If your baby is being overhandled, which is very common in the first couple of days with all relations visiting and handling the baby, your baby can be very, very unsettled and crying a lot, especially at night. Ways to comfort the baby then: pick the baby up. Can't really spoil a newborn baby. You could check their nappy first of all, make sure they're dry, they're not dirty, the nappy's not too tight, clothes are not restricting. Pot the baby onto the chest, making sure the baby's face is free so the baby can breathe. You can rub the back or pat the back to help baby get upwind if wind is the problem. Making sure that the baby's legs are nice and straight, the bottom is to the chest so that the tummy is good and straight there like that. Putting the baby in your arms and gently rocking the baby. Babies can get very, very irritated if you kind of jig them, and never, ever, ever shake a baby because it can have serious consequences.
Now's the time to enjoy meal times together, whether we're eating indoors or out. With everyday savers from Dunnes Stores, we've got barbecue-ready favourites like 4-pack Bordbia approved Irish beef burgers, just €2. Strawberries, raspberries, blueberries and blackberries, just €2. And real fruit ice lollies, only €1.50. Plus, with our grocery voucher, you save an additional €10 on every €50 you spend. Dunnes Stores, always better value.
Every year, thousands of children are affected by illness or injury, so knowing what to do is important, especially if you're a parent. When a child is sick or hurt, it can be a very frightening experience, but how you respond is vital. Basic first aid can often prevent the condition deteriorating or becoming life-threatening. The aim of these short videos is to give you the basic knowledge and skills to know what to do if your child is sick or injured. How you respond in an emergency situation could make the difference between life and death.
Gastroenteritis or tummy bugs are a very common problem for children. It's one of the commonest things that we see in the emergency department. Generally, it's a viral illness that is self-limiting and resolves itself without any treatment. But we want to tell you when to worry and when to come and seek medical help. Gastroenteritis, the children present with lots of frequent loose poos, sometimes associated with fever and sometimes associated with vomiting. But from your point of view, the most important thing to watch out for is whether the nappies are wet or not. If the nappies become dry, then the child is dehydrated and they need more support. Generally, the support that we give tends to just be oral fluids, which you can give at home as well. But sometimes we give intravenous fluids to help your child recover from this illness. Once your child has this illness, it's important not to spread it to other children, so hand washing at home and avoiding returning to the creche too soon is important so that the illness doesn't spread to other vulnerable children.
Most fits are not serious, but you may feel terrified watching it. Small children between the ages of 6 months to 6 years are prone to fits with a temperature, but most do not have epilepsy. At the start of an illness, as the temperature is rising, a fit can occur. Your child can turn blue, shake dramatically and froth at the mouth. Febrile fits are normally short and resolve by themselves in less than 5 minutes in most children. Any first fit needs an emergency phone call to get help. It is not likely to be serious, but you cannot be sure. First, you have to manage the fit with a little first aid. When a child has a fit, phone for emergency help, but also gently lie the child on his or her side on the floor in a safe place. Remove any nearby objects. Put nothing in the child's mouth. Note the details, what time the fit began and ended, and what does it look like. Check the temperature if you have a thermometer close by, but do not leave the child alone to do this. Most children like to sleep after a fit, and this is to be expected, so don't worry. Emergency help should be there soon. Years ago, people held down the tongue during a fit. Do not put anything in the mouth. It may make the child vomit, and that can be dangerous. When your child gets to hospital, the doctor will examine your child to look for the source of the temperature. The majority of these are simple viral illnesses which all children suffer from. Some children react to these by having a fit while others don't. It is likely that your child may be sent home and not kept in hospital, but it is important to get your child checked out.
Asthma is really common. About 1 in 4 kids wheeze at some point. It may be triggered by a viral cold-like illness or in some kids by allergies like pollen. The child may complain of feeling unwell, or you might simply notice that they are breathless when talking. You may also notice that they've stopped running or playing because they are short of breath. Look for signs of increased work of breathing, like a faster rate, visible indrawing of the wall of the abdomen just under the ribs, or increased movement of the neck muscles just above the collarbones. You may hear noisy breathing, such as a whistling sound or other abnormal sounds. Any child with asthma should have an action plan. This is a set of instructions for what to do if wheezing starts. This should include using an inhaler, usually this blue one, through a special plastic device called a spacer. A spacer is simply a kind of plastic bottle or box. The inhaler is attached to one end and the child's mouth to the other. Younger children may require a spacer with a face mask attachment, as this will ensure a good seal. It's really important to use this spacer. It makes it much easier as the spacer holds the medicine in the chamber while the child inhales. To use correctly, shake it, remove the cap and attach it as shown. Then gently hold the mask against the face, or the child may put its mouth around the other end of the spacer. Press to release a puff of medicine and watch the child take 4 breaths. You can observe the valve move with each breath the child takes. The action plan will usually say how many puffs of medicine to give, 4 or 6 perhaps. Then wait a few minutes. If they are no better, repeat. If still no better, seek medical attention as a matter of urgency.
Accidents happen, and this is especially so for children. A broken bone is a common injury in a child, especially after a fall. No matter what part might be broken, or how big or small the injury may seem, all broken bones need medical attention. Your child's bone may be broken if you've heard a snap or a crack during the injury, if there is swelling or bruising or tenderness, if they are in a lot of pain, or they are unable to move the injured limb. It's important to keep the injured limb as still as possible. This can be done securing the limb to the body with a scarf or towel, or by resting it on a pillow or cushion. Keep your child calm and comfortable by giving them some pain relief, and seek medical attention at your nearest hospital as soon as possible.
Road-related injuries are the #1 cause of death and serious injury in children. To reduce this, make sure your child is in a correctly fitted car seat or child restraint for every trip. This needs to be age appropriate. Reduce your speed to under 30 kilometers per hour when driving in residential areas, and ensure that your child wears a bicycle helmet when cycling, on a scooter or a skateboard. Beware of driveway backovers, and always watch out for young children when reversing your car. To avoid drowning accidents, make sure your child wears a life jacket if they're in a boat, and teach them how to swim at an early age. Never leave a child alone in a bath, even for a minute. Be especially wary of ponds and pools if small toddlers are around. To avoid burns and scalds, always use child-resistant cigarette lighters and never smoke around young children. Have a working smoke alarm in your home and make sure you check it regularly. Beware of hot drinks. Put the milk in first when making tea or coffee to reduce the temperature. Preset the temperature for hot water in baths, and never leave an iron or curling iron plugged in or within reach of children. To avoid falls, avoid baby walkers completely. Use stair gates to prevent young children falling down the stairs, and window guards to avoid first and second floor falls. To prevent choking, avoid latex balloons. Also avoid drawstrings on children's clothes and pull cords on window blinds. Young children have a tendency to put everything in their mouths, so be vigilant at all times, especially if they're playing with toys that have small parts such as Lego, or if there are foods about like peanuts or popcorn. To reduce the risk of poisoning, keep medicines out of reach or in child-resistant containers or blister packs. Be wary of household chemicals, button batteries and detergents, and make sure they are safely stored away.
Croup is a condition that causes swelling to the voice box and the windpipe, resulting in a harsh barking cough and hoarse musical sound called stridor. Stridor is usually more pronounced on breathing in, but can be heard on both breathing in and out. Croup is usually caused by a viral infection and affects children between the ages of 6 months and 5 years. Viral croup may start as a runny nose and a low-grade fever. The noisy breathing and barking cough frequently present overnight. A child with stridor does need a medical review by their GP or in the emergency department. The treatment for croup is usually steroids in liquid form. If the child has stridor when they are resting, then they do need medical observation until this resolves. More severe cases can require nebulized therapy. Croup can rarely be life-threatening, and in such cases a breathing tube is required to make the child's airway safe. In rare cases, other more serious conditions can mimic croup. Therefore, it is important to get your child seen if they have stridor.
In Ireland, constipation affects 1 in every 3 children. In 95% of cases, there is no known reason for it. This is known as idiopathic constipation. If your child is passing hard, dry stools with difficulty, less than 3 times a week, they may be constipated. If they are also having frequent accents, they may have impacted stools and are experiencing overflow diarrhea. This can be viewed by some as bad behaviour, but in fact the child has no control over this. If constipation is left untreated, it can lead to anal tears, which cause the child pain and in turn lead to holding onto the stool. There are some key points to remember. Know the different types of stool to identify constipation with or without overflow diarrhea. Type 3 and 4 are normal stools, type 1 is constipated, and type 7 with type 1 is constipation with overflow diarrhea. Impacted stool must be cleared out with higher doses of laxatives as prescribed by your doctor. After this clear out, maintenance medication must be taken to prevent a build-up of stool. A common misconception is that laxatives may make the bowel lazy. This is not true. Keep a diary for a week and look at how much fluid and fibre they are consuming. A typical 4-year-old needs over a litre of fluid and 9 grams of fibre a day. Your child should be sitting comfortably on the toilet with an insert and footstool if needed. Feet together with knees level with the belly button and elbows resting on the knees. Gentle pushing down can help the stool out. Blowing bubbles and balloons can cause enough pressure instead of going red in the face. Encourage your child to move around. Exercise of any kind is better than sitting in front of the telly. It will really help the bowels to move. Children that experience hard stools that are sore to pass will often hide in the corner and avoid the toilet. Keeping the stool soft will help, and eventually the child will forget the pain. But this will take time. Early detection of constipation is a must. Treatment takes time and effort. Talk to your GP about any concerns that you have.
Every day, children accidentally injure their mouths and teeth. Injuries can be as simple as bumps and scrapes, or as dramatic as knocking out a tooth altogether. Knocking out an adult tooth is a real emergency, and here's what you need to know and do. The tooth will have the best chance of survival if it is replaced quickly. This is ideally done within a few minutes. To do this, hold the tooth by the crown, not by the root. Clean it under running water and push it back in its socket. You shouldn't touch the root, as the cells covering the root are very delicate. Once the tooth is back in place, bite down on some clean fabric or tissue and go to the dentist straight away. If you can't get the tooth back in, put it in milk and get to the dentist immediately. Try to call the dentist on the way to let them know to expect you. Never replace a baby tooth that's been knocked out. If in doubt, put the tooth in cold milk and get to the dentist immediately. As a guide, it's useful to know that most children don't have any adult teeth until 6 years of age. For most other dental injuries, like fractures and minor displacements, there's no immediate first aid required, but you should give your child pain relief if they need it and call your dentist to arrange to see them as soon as possible. Baby teeth and adult teeth that have been dislodged a little can usually be gently pushed back into place by your dentist and are sometimes held in place with a splint or brace. Broken teeth can be fixed with a filling material, and if the inner layers of the tooth are exposed and sensitive, treatment can be carried out to keep the tooth healthy. Seeing your dentist within 24 hours is usually fine for these kinds of injuries. Cuts and scrapes to the lips and gums are quite common. Bleeding is usually controlled by applying pressure with a clean piece of damp fabric or tissue for 5 minutes. Make sure your child wears a mouthguard and an appropriate helmet for sports such as hurling, camogie, rugby and boxing, and a helmet for activities such as cycling, skating and scooting. Custom fitted mouthguards offer the best comfort, fit and protection. Frequent dental visits from an early age provide you with the opportunity to discuss oral health issues that are important for your child. Most people don't know that dentists recommend that you bring your child for their first visit by their first birthday. It's always good to start early to get the best advice possible.
Sunburn is caused by overexposure to the sun, and children are especially vulnerable to the sun's strong rays. Sunburn can be avoided by wearing a hat and long protective clothing and by applying a high ultraviolet protection sunscreen on exposed areas. If you think your child has been sunburned, look for 3 things: reddening of the skin, pain in the area that has been exposed, and blisters. If your child is under 1 year of age, seek medical attention immediately, even if the sunburn appears mild, as infants can dehydrate quickly. If your child is older than a year, remove them from the sun immediately. Cool the area down by sponging them with a cool, clean washcloth, or soak the area in a bath or shower for no longer than 10 minutes. This can be repeated a few times during the day. Encourage your children to drink plenty of fluids to keep hydrated and give extra fluids for 2 to 3 days. If the skin doesn't blister, then the sunburn may be mild and can usually be treated with calamine lotion or an after sun cream, which will soothe the sore skin. When going outside, all sunburnt areas should be completely covered to protect the skin until it's fully healed. Clothing should be loose so the burnt area is not irritated. If blisters appear, the burn is more severe and you will need to see a doctor. You should also seek medical attention if the sunburn covers a large area, your child has fever or chills, your child has a headache, confusion or feels faint, or you see signs of dehydration.
Liquid tabs are an effective detergent when used properly in the washing machine, but as such they contain potentially dangerous chemicals. When children get their hands on the brightly coloured pods, the consequences can be serious. Since the contents of the pods differ between manufacturer, the effects can vary. Once in hand, the pods can easily burst and leak liquid onto the skin. This can cause problems like rash, pain and burns. If a pod bursts onto the skin, it is important to first remove the pod from the child's hand and wash the liquid off thoroughly with cold water. We would always advise going to see a doctor for further assessment after you wash the skin. If a child then puts his hands to his face, the liquid may cause serious damage to the structure of the eye, resulting in pain, distress and infection. The pod should be removed and all exposed surfaces washed with water, including the face and eye area as well as they can tolerate. Any child with liquid tab contents in the eye needs to go to the hospital for review. We need to do a complete assessment of the eye and then wash it out with a lot of water to reduce the risk of further damage. If a child bites into or swallows a liquid tab, the contents may cause very serious effects like burns to the digestive system or breathing difficulties. All these cases need to be brought for assessment to a doctor or emergency.
When you and I get a cold, we tend to have a stuffy nose, we might have a temperature and we might have a slight cough. It gets better in a few days. If a small baby gets a cold, it can go down onto their chest and we call this bronchiolitis. So they start with the stuffy nose and the runny nose and then they develop a cough that seems to last sometimes forever, but generally it gets worse for about the first 3 or 4 days. The next 3 or 4 days are when you feel really worried because your baby doesn't seem to be getting better, but that's a normal pattern. And then after that the baby gets better slowly, though sometimes the cough can be there for up to about 4 weeks. It's usually caused by a virus, so no antibiotic or medicine will help you get better faster. We usually recommend is that you just mind your baby, not too much handling, feed them little amounts and often and they will get better by themselves. Some babies do need to come into hospital or do need a doctor. Key things to look out for are if you're just worried about your baby, if they're pale, if they look grey, if they look blue or tired or sweaty, if they're not really interested in their surroundings as much as they normally are. If their breathing is very fast or if they're having episodes where maybe they're even stopping breathing, or if you notice that they haven't had a wet nappy in a while. If you're worried about any of these things, just pop into your doctor or bring them to your local hospital.
Anaphylaxis is a severe and potentially life-threatening allergic reaction. The most common causes for anaphylaxis in childhood are foods. The most common foods being peanuts and shellfish, but also rarely common foods such as milk or egg. If you're having an allergic reaction, it might be mild or moderate. This would involve a rash, some facial swelling, possibly vomiting. If this is all that's happening, then what's needed is the administration of antihistamine and to keep a close eye on the child that the reaction doesn't progress. A reaction that progresses to involve shortness of breath or difficulty in breathing or circulatory collapse such as fainting, this is indicative of anaphylaxis. The treatment for anaphylaxis is adrenaline. The adrenaline pen should be given as an intramuscular injection to the upper outer thigh. It should be injected into the thigh, held in place for 10 seconds, removed, and then the skin around there massaged for 10 seconds. If you're not sure that the features they're having are typical of anaphylaxis, but you suspect because of difficulty in breathing or circulatory collapse this may be happening, then it is much safer to give adrenaline. Adrenaline is well tolerated by children and it is very unusual that it would do any harm to a child. If you have previously been considered at risk of anaphylaxis by your doctor, you should have been prescribed adrenaline and it should have been demonstrated to you by the doctor or by the pharmacist. Once adrenaline has been given, other medications, if not already administered, can also be given, such as antihistamines or asthma medications such as Ventolin. If after 5 minutes the child still remains symptomatic with shortness of breath or circulatory collapse, a second adrenaline pen can be administered in the same way as the first. However, If the child has improved significantly, then no further treatment is required until emergency services arrive. If you are having anaphylaxis and you do not have access to adrenaline, then it is important that you phone 999 and state the words anaphylaxis. Lie the child flat or get them into the most comfortable position they can manage, and if you have antihistamines available and they have not already been given, these can be administered. Otherwise, it is a case of waiting for emergency services to arrive who will carry adrenaline with them. It's important after adrenaline has been given or after anaphylaxis that urgent medical attention is seen. Even if adrenaline has been given and there has been a significant improvement, children must go to hospital.
We sincerely hope that you will never be faced with this scenario, but this skill is an easy and effective tool that may potentially save an infant's life. If your child is choking, he may appear distressed. He may have a silent cough or cry. His face will be pale and his lips may be blue. If this happens, supporting your baby's head and neck with his head lower than the level of his chest, in between his shoulder blades with the heel of your hand, you need to hit him hard 5 times. Don't worry about hurting your baby. You need to relieve this obstruction. Generally, back blows are enough to relieve the obstruction, but if your baby is still not breathing, you need to do 5 chest thrusts. This is done by using your 2 fingers in between the nipples, the lower half of his breastbone, going on an inward and upward motion to your baby's head. 1, 2, 3, 4, 5. You're going to continue doing chest thrusts and back blows until the object comes out or your baby goes unresponsive. If your baby goes unresponsive, you need to follow the guidelines for infant CPR. If you see the object in your baby's mouth and it is easy to remove it. However, never put your finger blindly into your baby's mouth, as you could push the object further back or you could injure the inside of their mouth, causing more problems. If your child has had a choking episode, they need to be followed up by a doctor.
Burns in children make up a significant proportion of our emergency department attendances. The majority of burns we see are caused by scalds from hot liquids and affect infants and toddlers. This is often due to their quick, unpredictable movements. We also see contact burns from heated appliances such as hair straighteners and irons. If your infant or child has sustained a burn or scald to the eyes, nose, mouth or neck, you must seek medical attention from your nearest emergency department immediately, as their vision or breathing might be compromised. If other areas are affected, you must still plan to seek medical attention, but in these cases it's safe to take a few minutes to apply some first aid measures at home. The first step is to cool the affected area under cold running water for at least 15 to 20 minutes. You may use a tap or a shower. This may be distressing for small children, but it is the most important measure to prevent further ongoing heat damage under the skin. The water temperature does not have to be freezing. 15 degrees Celsius is ideal, and remember to never use ice on a burn. The second step is to take off any wet or burnt clothing. If a piece of your child's clothes appears to be stuck to their skin, do not peel it away. Leave it in place and cut away the clothing around it. Many parents apply household products such as butter and grease to burns and scalds. We do not recommend applying anything to the burnt area until it has been seen by a medical practitioner. Greasy substances will only keep the heat in and slow down the healing process. Skin that has been burnt will often form blisters. If this occurs, do not pop the blisters at home, as this is your body's way of preventing a skin infection. Remember, burnt skin is extremely painful, so please give your child some pain relief as soon after the burn as possible. There is no medical reason to cover a fresh burn. However, if the burnt area is at risk of rubbing against objects or sun exposure on your way to the GP or emergency department, you may want to loosely wrap a clean, light cloth like a muslin or gauze around your child's burn. Do not apply anything tight to the area. The burns we see are almost always preventable. When minding small children, never leave hot drinks or dishes uncovered. Always keep heated appliances such as hair straighteners, kettles and irons out of reach. Never leave a mobile child unattended. Never leave a baby in the care of their young sibling with no adult supervision, and always check your child's bathwater temperature with a thermometer before placing your child in it. This information is intended for first aid only. Always seek medical advice for burns and scalds, no matter how minor they seem.
Happily, meningitis is much less common than before due to vaccination, but it is always wise to be on the alert for it. Watch out for a fever with a developing rash, which does not fade when you press against it, a high-pitched cry, and marked pallor. These are features of meningococcal infection and need medical attention immediately. Also beware of the child who has had chickenpox for the past 3 days and who then develops a second wave of temperature and a spreading red rash or reddened areas around the chickenpox spots. It may be that the chickenpox spots have become infected, but you need to be on your guard for a bug called strep A. This is a very nasty bug that can sweep through the system. If you suspect this, seek medical attention immediately.
Head injury is one of the most common presentations to an emergency department, and the vast majority of kids are diagnosed with minor head injury. There is often a bump or a bruise on the exterior of the head, and other symptoms may include nausea or feeling sick, mild headache, tender bruising, mild swelling of the scalp or mild dizziness. If your child experiences these mild symptoms after a knock, a bump or a blow to the head, you do not require any specific treatment. Observe them closely for 48 hours and monitor whether their symptoms improve or worsen. The serious symptoms to know about are unconsciousness, either very briefly or for a longer period of time, difficulty staying awake or being sleepy several hours after the injury, having a seizure or a fit, difficulty speaking such as slurred speech, vision problems or double vision, difficulty understanding what people say, reading or writing problems, balance problems or difficulty walking, loss of power in part of the body such as weakness of an arm or a leg, pins and needles in the hands or the feet, memory loss such as not being able to remember what happened before or after the injury, clear fluids leaking from the nose or ears since the injury, a black eye with no other damage around the eye, bleeding from one or both ears, new deafness, a loss of hearing in one or both ears, bruising behind one or both ears, or a lasting, strong, persistent headache since the injury, vomiting since the injury, irritability or unusual behavior, visible damage to the head such as open, bleeding wound. If any of these symptoms are present, particularly the loss of consciousness, even for a short period of time, immediately go to the emergency department of your local hospital or call 999 or 112 and ask for an ambulance.
For parents, one of the most frightening things that can happen is that their baby stops breathing. Follow these simple steps to administer CPR. Gently stimulate the baby by tapping the foot or squeezing the hand. Shout for help if there's no response, but remain with the baby. Gently tilt the head into the neutral position to open the airway. Have a quick look in the mouth to see if there is anything visible. If there is, lift it out. With the head in this position, check for breathing. Look for a rise and fall in the chest and tummy. Listen for breath sounds. Feel for air from the baby's mouth on your cheek, taking no longer than 10 seconds. If your baby's not breathing, give 5 rescue breaths by blowing gently into the lungs, covering the baby's nose and mouth, ensuring there is good seal and you can see the chest rising. Each breath you give should be approximately 1 second in duration. If there are no signs of life, example, eyes opening or limb movement, the baby's heart may not be beating properly and you must begin compressions on the chest. Place the tips of 2 fingers on the lower half of the breastbone and push the chest down gently but firmly to a depth of 4 centimetres. Push fast for a count of 30. Then give 2 breaths, followed by 30 compressions. Continue this sequence for 1 full minute. After this, if you are still on your own, make a call to the ambulance stating your emergency. Return quickly to the baby and begin with compressions, alternating breaths as seen, until the baby responds, or you can hand over to the ambulance.
Most poisonings we see in the emergency department occur in toddlers. Common substances are medicines and household cleaning agents. Most children with accidental poisoning do fine, but many substances have potential for very serious consequences. The commonest medicines ingested would be liquid paracetamol or ibuprofen. Most parents don't realise how dangerous paracetamol can be. Children may also take medicines which belong to an adult family member. A single tablet of some of these can be fatal to a toddler. For example, certain blood pressure medications, antidepressants, or tablets for diabetes. Other common but dangerous medicines include iron supplements and aspirin. Household cleaning agents are often quite corrosive. A very small amount can cause burns to the mouth and throat, resulting in pain and damage. Antifreeze for cars contains an extremely toxic alcohol. A very small quantity is poisonous. If you find a child with medicine or household agents, stay calm. Remove the poison from the child. Wash any visible product off the skin with plenty of water, including the eyes. Do not give a drink unless advised to do so. Never force the child to vomit. Call poisons information. If the child collapses or has a difficulty breathing, call an ambulance. Go to the emergency department and bring the medicine or solution with you. Usually, when a child accidentally drinks a poison, it's because someone has transferred it into a water or soft drink bottle. That's why cleaning products or weed killers should never be decanted from their original packaging.
So, food allergy affects approximately 3% of young children. That's roughly 1 in every 30 children, mostly young children. The commonest allergen amongst Irish children would be egg white, and most children are exposed to egg white in the form of scrambled eggs, which is partially cooked egg. The other allergens that are recognised would be milk, notably cow's milk, and then nuts, probably peanut and the tree nuts. Approximately 1% of children have peanut allergy. Typically, the reaction that parents will notice with a food allergy is a rash on the skin, which is usually a redness around the lips or the mouth, redness on the chin, redness around the eyes, or they may have a hive or nettle sting-like rash. They can also get swelling of the lips or swelling around the eyes. In some instances, food allergy reactions can be more severe, such as with coughing or wheezing or other airway difficulties. Children may also get vomiting and abdominal pain, and these would certainly be more severe type reactions, but are less common. The majority of food allergic reactions in children are managed with an over-the-counter antihistamine, which is typically given by mouth. These have a prompt and immediate effect. In certain situations, such as those children with more significant reactions, they certainly may need to have an adrenaline pen as part of their allergy action plan. Majority of food allergies in children will resolve by late childhood, and this is certainly true for milk allergy and egg allergy. However, certain nut allergies will persist through to adulthood, and we are well aware of many patients with peanut and tree nut, which are almonds, Brazil nut, walnut, etc., persisting through to adulthood. If you have any concerns about your child having had a reaction to a foodstuff, you should contact your primary care provider. More information is available on the Irish Food Allergy Network for parents, and risk factors for more severe reactions would include severe or poorly controlled asthma. So certainly if your child has had a reaction to a foodstuff and also has a diagnosis of asthma, you should obtain further information and contact your primary care provider, and then ultimately secondary level care through an allergy clinic.
Vaccines are a simple, safe and effective way of protecting children from serious infectious diseases. Before vaccines were introduced, diseases like polio, measles, TB, diphtheria and whooping cough caused serious ongoing health conditions and killed hundreds of children. Today, because of vaccines, it is extremely rare to die from these diseases in Ireland. Vaccines work by triggering our immune system to fight certain diseases. If a vaccinated person comes in contact with these diseases, their immune system is able to respond more effectively, either by preventing disease or reducing its severity. Getting your child vaccinated helps protect others in your community, like your neighbour who has cancer and cannot get certain vaccines, or your friend's newborn baby who is too young to be fully immunised. When everyone in a community who can get vaccinated does get vaccinated, it prevents the spread of disease and can slow or stop an outbreak. Routine vaccines protect against 14 childhood diseases, including whooping cough, measles, German measles, meningitis and pneumonia. 2 vaccines also protect against cancer, the HPV vaccine and the hepatitis B vaccine. The recommended vaccine schedule is designed to protect infants and children early in life when they are most vulnerable. Their immune systems are not yet fully mature, making it easier for bacteria and viruses to multiply. Booster vaccines are given when children start primary and secondary school, as they are exposed to more children and therefore to more infections. Childhood immunisations are recommended at 2, 4 and 6 months, 12 and 13 months, 4 to 5 years and 12 to 13 years. These vaccines are available free of charge for all children. To be fully immunised, children need all doses of all vaccines in the recommended schedule. If your child doesn't receive the full number of doses, they're vulnerable to serious diseases. You can obtain the latest schedule information by talking to your doctor or online at immunisation.ie. Vaccines are very safe. However, like all medications, vaccines may have side effects. While your child may experience some discomfort or tenderness at the injection site, this is minor compared to the serious complications that can result from the diseases that these vaccines prevent. A slight reaction actually shows that the vaccine is having the desired effect on the immune system. A child may also get a mild temperature, be out of sorts and off his or her food as a result of the vaccine, but these generally get better themselves in a day or two with cuddling. Serious side effects from vaccines are very rare. If you have any concerns about vaccine safety, mention them to your doctor. Your child should not be vaccinated if they have a fever over 38.5 degrees. Check with your doctor if your child has ever had an allergic reaction or is undergoing treatment such as cancer treatment, which suppresses their immune system. Keep a record of your child's vaccinations. To find out more about immunisation, go to www.immunisation.ie.
Don't get much for €1 these days? You do, with new everyday savers from Dunnes Stores, like our award-winning bolognese sauce. Just one of hundreds of our quality everyday items for €1 or less. Dunnes Stores, always better value.